Hi, everyone, and welcome to the Friends of NPACE Podcast. I'm Terry Schmidt, the Executive Director of NPACE and practicing family nurse practitioner. And I actually am super excited about today's episode because you started with us on the very first podcast we ever did.
We had a good time.
Yes, and I have a very special guest here who's been with NPACE since the beginning, the inception.
Since 1980.
Yeah. This is Dr. Mimi Secor. She served NPACE many years. She's currently, well, you were an NPACE board member. Now you're emeritus, but you still advise us.
Yeah, I love doing
that.
that.
I love. She's also a speaker, a nurse practitioner, a national speaker, an educator. You are a #1 international best-selling author.
That's kind of exciting.
I know it is. And you're a health and fitness advocate, which has been beneficial to me. Mimi has been a family nurse practitioner specializing in women's health for 45-ish years.
Yeah, that's good. The ish is good.
Recently,
I like that.
Recently, she's been more focused on health and fitness. She's also you were senior faculty with NPACE.
With APEA.
APEA.
Advanced Practice Education Associates.
We're not going to edit that out because this is so fun and I mess it up. Yep, APEA, and you're a fellow of FAANP and the American Academy of Nursing, AAN. But we're going to talk about other things today besides your professional career.
Yay, I'm excited.
I'm glad you're here. We're actually going to talk about, and I'm just going to put my pen down and we're just going to chat about your experiences in the last year being patient. I really think we, as nurse practitioners, clinicians, sometimes forget what that's like.
Oh my gosh.
Absolutely. So if you want to share a little bit about what that's been out, a little bit of your story, what's been going on the last year.
It's been quite a year.
Yeah.
I feel like I'm coming out of a time capsule. So last year in May, I started having one symptom, urinary frequency, and I'm a postmenopausal woman using local estrogen. So I was thinking to myself, that's a little strange. I shouldn't be having problems, but my cultures were negative. My lab work was negative and the symptoms continued. And of course, we're on a bicycle trip. So I'm thinking to myself, maybe it has something to do with bicycling every single day.
Sure.
So I saw a pelvic PT and they seemed to be helping me when I got back from my trip. So I'm thinking, well, maybe I don't really need to get more testing. But in my brain, I'm thinking, gosh, I really need to think about those ovaries, those postmenopausal ovaries. And I couldn't get that out of my head. So I asked my primary care if she would order an ultrasound for me, a pelvic ultrasound. And there was the rare fallopian tube cancer that I was shocked to find, totally shocked, because I never worried about cancer. And I never worried about fallopian tube cancer. Who even knows about that? So fast pedaled to Dana-Farber in Boston and started seeing an oncology team and had a hysterectomy and started chemotherapy. I was really lucky because the chemotherapy could be targeted to my abdomen, to the peritoneal area. So I had chemo there, which was a nightmare to receive, but it went to where the problem was. A few cells had escaped, a couple lymph nodes were positive. So beyond removing the tumor, they still needed to treat me aggressively. So they did. They treated me like I had ovarian cancer, which they did because they don't have research on sufficient numbers to really target tubal cancer. So that was interesting. And in my entire career, I'd never seen anyone or worked with any clinician that had seen tubal cancer. So my message is to clinicians, take your patients' symptoms seriously. You know, I hadn't even had bloating or digestive issues or bowel changes or any of that, just that one singular symptom.
And an ultrasound, which
pelvic ultrasound,
easy to get,
inexpensive. Right. So don't wait until patients have had symptoms for a long, long time. And if I'd gone to urology, I don't think they would have even thought of a pelvic ultrasound. But that was the next clinician I was going to see. So I asked my primary, I'm like, I really need to have a pelvic ultrasound. And, you know, she said, you've had symptoms 4 months, but if you want that, I trust you, you're in women's health, we'll do it.
But none of the classic symptoms.
None of them. No bloating, no digestive issues. Yeah, well, they ordered with the ultrasound a CA-125, which was elevated. I asked for it.
Sure. I mean,
you know, we as nurse practitioners need to advocate for ourselves. So it was an awkward situation, though, because I'm thinking, am I over worrying? Right?
Yeah.
Am I paranoid? Well, sometimes we have reason to be paranoid. So I'm really glad I was.
How involved did your family practice, your primary care provider, stay throughout this whole process?
She did. She passed me off to the team at Dana-Farber. And I was hospitalized at Brigham and Women's when I had the chemotherapy, the abdominal chemotherapy.
Okay.
So I was there for like 4 days every 21 days. Got to know all the nurses really well.
Okay. I was actually going to ask what that protocol is like. So currently, is it 4 days on, or do you go in one
So
day? They start.
protocol is a 21-day cycle.
Okay.
And day one, I would receive 24 hours of Taxol.
Okay.
So that's a long process. It's not like a few hours. So it helped to be in the hospital because I was more comfortable there physically.
Yeah.
And then that was followed by the peritoneal chemo.
Okay.
That's when they put 2 liters of fluid in your abdomen and then follow that with the chemotherapy, which was cisplatin,
Gosh.
which is kind of ugly. And then they would turn me with all this fluid in
To bathe the whole.
to, bathe the whole abdominal area to get those cancer cells that were in the little crevasses. So that was kind of crazy. And I never felt good after it. I felt like even during it, I was like requiring Dilaudid, which for me, taking nothing was a lot. But it just made me feel like my lungs were going to explode and my abdomen was going to explode.
How long did that last?
That took about 6 hours total. So that was kind of miserable. And then initially they tried to send me home and I would just be so miserable. I could not sit in a car.
Yeah.
It was just awful. So they ended up just keeping me overnight
Mm-hmm.
for all those cycles, those
For
6
symptom
cycles.
management, yeah.
Right. So I was way better just laying motionless in the hospital bed and having the nurses help me. So it ended up being about a 4-day per 21-day cycle. And the following day 8, I would do an outpatient treatment with just Taxol intraperitoneally again. And I always dreaded it because it was just miserable to go through.
Yeah, not fun drugs, right?
No, but it really worked for the minimal disease I had. If it had spread more, I would not have qualified for the intraperitoneal, which I was grateful to qualify. And you also have to go into it really healthy. Like they can't take somebody that's not healthy because it just wears you out. At the end, you're just like, I think I'm gonna die.
Right.
You're so worn out.
Yeah.
The systemic, I didn't find that bad. I found it wasn't so bad to tolerate.
Right, but the peritoneal is
yeah,
a different
like,
kind of
oof.
interesting.
Yeah, very.
About that. How are you now?
Good. I'm good.
You're good.
Yeah, I have great energy. I have numb fingers and toes and tingling. My balance is off because I've lost hearing in my right ear. So, they really try to nearly kill you and bring you back from the precipice.
Nerve damage.
And then you deal with it. Yeah, the most peripheral nerves take the hit.
Yeah.
And I didn't have a problem till the very end of chemo, which was really interesting. So I lost a little hearing during chemo, but I had no problem with my fingers and toes. And then 2 weeks after I finished, they just were on fire.
Does the oncology team follow up on those kind of things with you?
They do. They do.
What's your advice?
Well, I have to tell you, they start you on various medications and you can titrate up. I tried gabapentin and I got up to 600 milligrams 3 times a day. And then I really didn't want to keep going up. So I switched to Lyrica. I'm just on the starting dose now.
Oh, yeah.
But I need to bring the dose up and nothing has changed. So the only thing that really helps my symptoms right now is to use lidocaine patches.
Oh, yeah.
So at night I pop those on and my fingers and toes feel pretty good, but I can't function with those patches on. And topical doesn't really help, just the topical ointments or lotions, or I've tried CBD, I've tried, Voltaren topically. I'm on a host of various and vitamins that people have recommended, including ALA. I'm on that too. So who knows, if something helps, I won't know really what it is. Was it the B, C, D?
The ALA.
ALA. What was it? Was it Reiki? Was it therapy? What was it? But I just can't wait and try one thing at a time.
That's my jam. Have you gone to Reiki?
I'm a Reiki freak.
Really? I'm certified.
Oh
I
my
saw patients
gosh.
before the pandemic.
I love
And
Reiki.
level 2, I would love to be a Reiki master. And then the pandemic happened and I got crazy with work and I just
Wow,
picked
it is magic.
Is it not magic?
It is wildly magical. So I have a therapist I see every couple of weeks and she does Reiki after the therapy. And
Yeah.
sometimes I don't really need a lot of therapy. So we just go to Reiki and it's just amazing.
Good. I'm glad you like it.
I'm not sure it's really helping my fingers and toes, but I always feel way better.
Come out of there for several days.
You're
it's like a tune-up.
whoa.
Yeah. I went because I wasn't sleeping and having anxiety and I was exercising, eating right, doing everything right. And I'm like, I'm gonna go. It's probably like voodoo. This was years ago.
Probably.
And
like
I came out feeling the best I felt in years and like, well, I'm going again and again. And then I'm like, I got to go to school for this. What is this?
Absolutely. I'm so glad to hear that.
Thank you.
There's a Reiki person at the conference.
Really?
If I can find her, I'll.
We're at a conference right now, so there's that.
Yeah, we're having a great time
Sorry.
at the conference.
We are, we are.
So I'm trying everything and anything I can do to kind of manage my symptoms.
Yeah.
Yep.
Okay. Well, it gives you a little bit of control and trying
Yeah.
to see
Yeah,
what helps. I
absolutely.
mean, not that has to be a prescription.
Right, exactly.
Coming into this as a nurse practitioner and a clinician who saw patients, who saw women for years and diagnosed
Right.
them with all kinds of things.
Right.
What did you not know, or how did your perspective change in your
Oh
journey?
my
over the
gosh,
last
my
year?
perspective just changed totally in terms of just feeling how vulnerable patients are when they come to see us. We get so used to seeing patient after patient in X amount of time. And
Mhm.
oh my God, I felt so vulnerable. Right now, I have like chills and I'm feeling emotional because I did not expect to feel so vulnerable. And man, those nurses, especially the new generation of nurses, I was
Mhm.
just touched by how connected they were with me. They didn't take they didn't take a massive amount of time because they were busy, but they took enough time that I felt
Yeah.
very cared for. And I would just say to them, "You're precious. I really appreciate you. I know you're really busy." And they'd hold my hand, they'd give me a hug. It was just beautiful.
The nurses.
Yeah, and it could be other people. It could be the
Right.
house cleaner. It could be the
Mhm.
nursing assistant. It could be the doctor doing rounds or the nurse practitioner or PA doing rounds. I
Mhm.
just felt extreme empathy out of most of the team. I didn't expect that.
Do you think it'll change the way you practice and interact with other? I mean, you're really
I've
caring
always
and
been
empathetic.
very
You
heart
are.
focused, but I'm more so now. I think I listen better and read between the lines better and appreciate how vulnerable people are when they're, especially with a cancer diagnosis. You don't know if you're going to live. You have no idea. All of a sudden, the whole world is just, your whole life is just right there.
Yeah, vulnerability. And I don't ever think of that. Seeing patients in and out all the time with all kinds of
I don't either.
chronic, life-threatening, and we just treat and move on.
We all have to because we have to see patients so quickly. But I think the message really is if we take care of ourselves, we can make the heart-to-heart connection in very little time. And research shows us that it doesn't take a lot of time. If we can just take a few moments to make that connection, then we can do our efficient work and the patient knows that we care. And that's really what I observed.
It's interesting that that's the thing that stood out to you the most. It
Mhm,
wasn't where you
mhm.
were, or the technology, or the competence. It was
Well,
what
that I was aware of. I watched very
Okay.
carefully. I asked many of the nurses how they felt about taking care of a nurse practitioner, these young nurses.
Oh yeah, what did they
And
say?
they said there was a consensus about me, that I was very, very caring about them and supportive of their roles, but extremely observant. So they needed to be careful, which I thought was really sweet. I mean, they were very careful, but and sometimes they weren't all that careful. There was one nurse who left a needle in the bed when I was
Oh,
getting ready to go home. I was checking to make sure I hadn't left my phone in the bed, and I find this hunkering big needle that was used to insert into my port
mhm.
in the bed sheets. I never did anything about it because I didn't want to get her in trouble because she really did a wonderful job taking care of me. But it really,
Yeah, it's probably a good reminder for them, though, too, that they need to be as careful with everybody, not
yeah,
just because
exactly,
you're a
exactly.
nurse practitioner.
Yeah.
But yeah,
I had some failures with the IV tubing where the chemotherapy leaked out of a filter twice. I felt moisture and I'm like, what is this moisture? It's like, what? Why is my, you know, pip wet and saturated in the chucks underneath me, the pad? And it was just liquid, chemotherapy liquid leaking out of this defective filter. Happened twice. So we had to go through this whole cleanup of the room. Of course, I helped them with the cleanup.
of course you did. Because why not?
And then it happened again. And so the whole system, I think, has changed because as a result of those two chemo incidents.
Interesting. I
Yeah.
wonder if they reported those filters.
I think they did. Yeah.
Yeah.
Yeah. Because the supervisor got involved and who knows who else got
Oh,
involved.
look at you. Helping prevent sentinel events.
Yeah, exactly.
Couldn't happen to a better patient.
And it was funny because they understood that I understood that it was just a equipment failure.
Yeah. So it's probably not going to change your practice, but the vulnerability was the biggest thing that stood out. So you've been doing women's health for years.
Years.
Did anything else stand out practice-wise in diagnosing women with cervical issues or
I do think
uterine?
that it was a wake-up call for me to utilize my platform when I teach,
Mhm.
to, when it's appropriate, share some of these lessons about early diagnosis. We don't have early diagnosis with ovarian cancer right now, or tubal cancer, nobody's even heard of.
Right.
So when it's appropriate, I like to share my case a little bit.
Yeah.
And I did that here at the conference, but I tried to do it in a way that was not, I don't want, you never want as a speaker for people to feel badly for you,
Ah,
to worry about you. So I kind of waited till the tail end of my second presentation. But I do think there's a lot to learn from my case.
no, definitely. There definitely is. And I appreciate that you're sharing it with
Thank you.
us.
Thank
Yeah.
you.
What do healthcare providers do really well, and what can we work on from a patient perspective?
Goodness.
Like where
We
you're,
do the best we can. You know, I'm very
yeah,
impressed with, we do the best we can with very small increments of time, whether we're in the hospital, we're in the clinic, we're doing the best we can. And for patients to really appreciate that, I think is important. And for us ourselves to appreciate the constraints of the system we're in right now, it really does try to just beat us to a pulp. And we have to, that's more reason to take care of ourselves so that, you know, when we're under these great time constraints, we know that we're good, we're rested, we're eating, we're drinking, we're going to the bathroom, we're at least meeting minimal Maslow's hierarchy of needs.
I love that you're still preaching self-care, and then that's her platform.
It
By
is
the
my
way, is
platform.
clinicians taking care of
And
themselves.
they always say they don't have time, which is just not true. You have time to care, you have time to make a deep connection, you have time to take care of yourself, maybe not in dream increments of time, but minimal. 5 minutes of movement, just having something healthy like some water right now
Yeah.
is gonna really help you over time. It does not have to be like 3 hours at the gym.
No, I appreciate that. Did you advise any of the healthcare providers who were taking care of you? Did you ask them? Do you have
I
water?
did,
Have you
I
gone to the
did, I
bathroom?
did a few inquiries.
You
I
had
did a
water?
few, and I brought my yoga mat with me so I could stretch on the floor in in the room that I was in,
Oh.
or go to a lounge if I could find a lounge. I got to be on the same floor most of the time in pretty much the same room. So I was able to either stretch in my room and hope that the nurses don't smash into me when I'm stretching, but I preferred to go to a lounge that I discovered and stretch there. I didn't have much other energy because I was usually attached to a contraption with, you know, IVs going and chemotherapy going, but I found stretching made me feel so much better.
Really?
Getting out of those terrible hospital beds that will literally maim you. They're so uncomfortable. So they got a kick out of that. Mimi's walking down to, she's got her yoga mat. She's on a mission to go stretch, and I'm certain no other patients were doing that.
Wow, you have the knowledge too. I mean, that would be a great intervention area.
It would be a
for
great area of
hospitals.
research to
Yeah.
have yoga mats and help people to stretch and feel more comfortable and assist them even.
Yeah. So we should be kinder to ourselves
We could, we
and
should be,
take care of
we
ourselves.
should be.
Any major system issues that maybe you weren't aware of before, as we pass patients off to specialty or they're in repeat, like, oh, we have to renew this prior authorization yet again, or,
Yeah, you know, we always have those unfortunate roadblocks, but I had extreme, the system was very efficient with me.
excellent.
Having to be admitted to the hospital, sometimes it took hours and hours and hours, often 6 hours, sometimes 8 hours, and I'd be waiting in the lobby and everybody else would have their room assigned, but they knew they tried to get me on the same floor in the same wing
Gotcha.
most of the time, so I knew I had to wait. Got to know those front desk people really well and where to rest when I could and lay down. I think the system overall was excellent.
Good.
You know, I don't think
Oh, I'm so
I
glad to
don't,
hear that.
I think the new generation of nurses need to be better with their procedures, better technique, not sort of set their supplies up on the patient's bed, but have some kind of tray or system. I still think I'm gonna deal with that, but I'm not sure at what level. I don't
I
wanna,
like that.
yeah, I think there's an effective way to make system change and one that upsets people. So
Gotcha.
it's only been a few months for me, so I have time.
Yeah, you do, definitely. Um, primary care providers, one piece of advice for
Oh
us.
my gosh, listen to the patient. Don't just assume because they have vague symptoms, they don't have something very serious. Vague symptoms, non-specific symptoms, only one symptom like I had, If they're postmenopausal, you need to take them very seriously. And
Okay.
even if they're not postmenopausal, I have a friend that has breast cancer at age 38 now. She found her own lump. When she went to her primary care, they're like, "That can't be cancer. You're 38 years old. No family history." Well, it turned out to be very aggressive breast cancer.
Yeah.
So I think we need to just appreciate the numbers are increasing in young people in terms of cancers. We know that. That's why
Mhm.
guidelines are changing.
Right.
That's why the mammography guidelines have changed to age 40 from the United States Preventative Services Task Force. They don't change easily.
Right.
So
Take some
we need to be
evidence.
extremely careful with our patients.
Okay. So trust them and listen to our patients.
Right,
Okay.
right.
I appreciate that. Um, anything else from your journey that you think is, changed who you are, or how you practice, or?
I just think that it illuminates the importance of connection and that social media is a helpful tool, but it's not as good as in person. And it was designed to be created to enhance in-person relationships. So I would just encourage everyone to make more personal connections. I met a friend and we played golf with her. I only knew her through social media. I'd known her over 10 years. And meeting in person, it was just fantastically wonderful for her, her husband, my husband, me. It was
Nice.
beautiful. We did it the day before the conference.
I love that. You said that to all the attendees here at the conference. You
That's
said, isn't
great.
it lovely to be
Here in person.
with each other?
Yes.
And it means something.
It does.
Yeah.
I know we're doing more and more virtual visits, but there's nothing like that in-person relationship, and just don't squander it. See it as a very special, sacred interaction. Is what I would advise.
I just want to say thank you to being here
you, Carrie.
again for
Thank you.
podcast number 2.
Thank you. I need a hug.
Oh,
Thank you very much, and we'll give you all a hug out there, you
We
virtual
will. We're
attendees.
sending you
Thank you for
virtual.
joining us. We really
Yes.
appreciate it.
So we're going to wrap up here. Thank you to Dr. Mimi Secor for being with us. You can find this in all of our NPACE podcasts, and podcast number 1 that we did with Mimi, where she talked about self-care. That was what she talked about in the first one. You can find us at Spotify, at Apple Podcasts, on YouTube, at learn.npace.org. And you can also find more of Dr. Secor's fantastic education. What she's doing this weekend, we'll have up in 90 days, but you should join us in person
Yes.
sometime. So we appreciate you being here, and we're going to sign off.